A recent survey shows many Quebecers with type 2 diabetes are not aware of the serious side effects that can come with the disease, such as cardiovascular disease. Matt Grillo explains.
Ken Harding was living an active lifestyle in his late 40s and thought he had his health in check. Except he started feeling dizzy when exercising and didn't have the same energy level.
I thought maybe I had a heart problem or something. So that's when I went, and they actually went for the testing, and I found out I was a type 2 diabetic.
So he went to see a doctor and found out he had type 2 diabetes. The timing of the diagnosis came as a surprise.
Because of my mother being having type 2 diabetes, and actually I had also my brother that became type 2 diabetes. So I was expecting it maybe, but not that soon.
But what he didn't know was the disease can increase the risk of heart attack, heart failure, and stroke. He's not alone. A recent survey commissioned by a group of pharmaceutical companies shows 63% of Quebecers with type 2 diabetes are also unaware of these risks.
The worst thing from that survey is only 56% says that heart disease is a problem in patients with diabetes.
Dr. Paul Poirier says type 2 diabetes can be genetic, but obesity is a risk factor. Diet and exercise are two key ways to keep diabetes under control.
Around 15 to 20% of obese are diabetics, but 80 to 85% of patients with diabetes are obese.
Poirier says diabetes can have other serious impacts, like blindness and loss of limbs. He points out some people don't even know they have the disease.
People who get the type 2 diabetes diagnosis when they see their general practitioner, they've been diabetes for at least 3 to 5 years.
For Harding, he thinks the gap was short, but the diagnosis hasn't come without its lifestyle changes. He's cut sugar from his diet and takes medication.
It's taking days off of my life right now. I'm thinking about my children, my grandchildren, maybe someday, that I'm not going to be able to see as long as I thought because of this disease.
He hasn't had any complications, and he's hoping with good diet and exercise that can continue. Matt Grillo, CTV News.